everyone. Welcome to this Roundup. The COVID-19 pandemic is threatening human health and lives of people across nations. Since this virus is highly contagious and is causing severe respiratory disease, it has quickly overwhelmed public health systems. While most nations and its governments have responded by declaring a public health emergency and are adopting known measures to prevent the infectivity and limit the viral outbreak, millions of lives have been significantly altered and there is no going back. As COVID 19 continues to radically transform daily life for everyone, there are many growing concerns about the state of public health. To discuss this further, I'm delighted to welcome Professor Dr. Rajesh Balkrishnan to this roundup. Professor Dr. Balkrishnan, he's a professor of public health at University of Virginia School of Medicine, and his research program focuses on health services and epidemiology related to global medical care access focused on long-term pharmacological treatment of medical conditions. Dr. Balkrishnan has published over 350 papers, books, and book chapters and has been recognized nationally and internationally for his expertise in effectiveness research and evaluation. He's based in the United States. Welcome, Professor Balkrishnan. We are so very honored to have you on Risk Roundup.
Thank you so much. It's a real pleasure.
Wonderful, Professor Balkrishnan. So the world is hit with a pandemic. It's caused by a virus, and millions of people are impacted. Hundreds of thousands are already dead. Amidst the COVID-19 pandemic, the one question that comes to everyone's mind is our healthcare system effective?
I think you raise a really good point. I think one of the things that this particular pandemic has really exposed is sort of the gaps in our system. I think our investments in public health, especially with regards to outbreak, epidemiology and control, are not quite there yet. I think we do not have in our systems the ability to respond in a timely and effective manner to address these type of pandemic outbreaks. I think a lot can be done very quickly, but when such pandemics occur, time is of the essence. So one has to act very, very quickly. Even delaying actions by a little bit, such as requiring complete isolation or people not to sort of interact with each other within close physical distances, have to be sort of implemented immediately. So one of the things I think which really we are lacking in our systems is the ability to predict the risk of the actual risk and the impact of several of these pandemics. And I believe as we are going to see a growing increase in the number of such public health emergencies. And I think it's time now that we begin to invest in systems that are truly prepared to address such emergencies.
Absolutely. No, I hear your point, and we have to be very concerned about the current state of this pandemic because, if we are going to hit with a pandemic that is caused by a virus, then how are we managing that pandemic? If we look at this pandemic, we are managing it pretty much the same way as our last pandemic, that was the Spanish flu. So right. If we look at the measures that we have taken currently, then we think about it, what have we learned in a century? Where have we made advances and where we have not, focused? And like you said, that we have not focused much on the investment in public health system. Now, to understand the effectiveness of medical care, it is important to understand healthcare and human health. So how are we understanding human health and what determines the human health and who is actually responsible for human health?
I think, public health research in this country has demonstrated the effectiveness of many interventions and technologies like vaccines. Yet there sort of seems to be a reluctance to adopt many of these technologies when their effectiveness has been clearly shown. A lot of this is because of political bias and because of other agendas that are in place, unfortunately. One of the issues with viruses is that they sort of mutate fairly quickly. They sort of develop resistance very quickly, and we do not, and they tend to especially attack really immunocompromised individuals. So I really think we have not paid enough attention to the importance of developing effective vaccines, developing effective strategies to combat these type of pandemics. And some of these don't require a huge infrastructure. They just require a plan of action in place to sort of like kind of begin acting almost immediately and hit the ground running when such an attack occurs. Unfortunately, we clearly see this, and especially this is true in the United States, which has been impacted the most because of this pandemic, is that the messages that are being sent in terms of the need to maintain physical distances and sort of truly take precautions against spreading the virus, because this one can pretty easily be spread by direct respiratory contact, are not in place. Many individuals, including those in high positions of power, are still continuing to either deny that this pandemic is real or to downplay the seriousness of what has happened, when the actual numbers seem to suggest otherwise, where we are approaching close to 2 million individuals in the United States who have tested positive for the virus, and the death toll has reached 100,000. So this is probably going to get to the situation where the US will have total number of cases more than rest of the world combined. And I think a lot of this is because of the mixed messaging related to public health that is going out over there. And we just are not in a position to do that. I know that this is a country that is driven by economy and economics, and so a large period of time where people are not going to work seriously hampers the economy. But the truth still remains that we have still not reached a safe enough situation that it is possible to resume normal human life quite yet in the United States. In fact, we are far from it. Many of the states are still showing an increase in the daily number of new reported cases of COVID positive patients.
Sure, no, I understand your point, and there is a lot of confusion, and there is a lot of different, thought leadership in how we should proceed. Especially, if you look at the risk of to human life, how many people could die from this pandemic versus if the supply, if we stay closed, if we don't open our economy, then the systems will start shutting down, and the global supply chain will start getting impacted. And once the global supply chain gets impacted, for instance, the food industry, the agriculture industry, if those gets impacted, then probably millions and millions of people will die. And that is the fear behind a lot of the decisions that many governments, not just our government, but many governments are making, that if the supply chain breaks, and especially if the food supply chain breaks, then what would be the impact? For instance, right now there is a lot of concern that in Africa a lot of people will die, millions will die, not because of the virus, but because of the hunger and famine that will follow because of the broken supply chain. So those are very different decisions that every country's decision maker is focused on. But the real challenge is here that this is a virus, it's a particle, and there are trillions of particles in our ecosystem. There are trillions of microbes, if we look at it, inside our body, on our body. And if we look at how our human genome, what our human genome is made of, every time we get a viral infection, our body the viruses leave behind a certain, of their genome, and I read somewhere that almost half of our human genome is made up of viruses. So the pandemic, that we are going through, it is going to change us as a species, because the virus, it will leave behind certain characteristics. We will develop certain new traits because of it, very likely. That is how human evolution has largely occurred. So this is a very, very unique time where, of course, we are very, very concerned about how many people are going to be impacted because of this, and who is dying, and who is most impacted. It's also a very curious time scientifically, that where are we going to reach as a species, and what's going to be the impact of this pandemic, and what has changed in our ecosystem that has allowed this pandemic to happen, because we humans and microorganisms have been living in symbiosis.
Sure,
Of course, some microbes
sure.
are deadly, and that can kill us. But what has changed in our ecosystem, that we have got this rapid spread of this virus, that is something everybody is trying to figure out. And as we know that this has impacted the society at its very core. So the
Sure.
question is, it's not just about the human health crisis or how many people will die. This is a societal crisis. Do you see that we are impacted at our very core, and it's not just a health crisis or economic crisis, but it has become a societal crisis?
No, definitely. I absolutely, totally agree with you, because we are seeing a lot of impact on society because of the virus. Just to give you an example, there are studies which are showing that because of the COVID isolation, the incidence of domestic violence cases has drastically increased in the country. So again, this sort of tells you how something like this, which is sort of a virus caused, truly impacts society. And impacts our societal structure and societal fabric. I think one of the things that I would really urge people to be very cautious about is sort of the overt optimism about a vaccine, and how soon it's going to be developed. Um, you know, um, it's not that easy to develop a vaccine that is not only effective but also safe in large populations. So just to sit back and think that there'll be this COVID is going to be behind us in a matter of months, and there's going to be a vaccine almost in a few weeks, I think is a little too optimistic, given the current scenario. I think obviously the stress and strain which is created because of the economic impacts this has had, because of people losing their jobs and so on and so forth, is also going to trickle down into society. um, i think um, I think we're already seeing like panicky behaviors at grocery stores, in some places, in places of public transportation. We are seeing a very, very troubling behavior. So I agree with you that this is a troublesome situation for the world, and especially in those areas which sort of depend on other places for sustenance. Like you mentioned, like there's a lot of issues in Africa with food security, but we are seeing a huge food security issue here in the United States as well. There are images daily in the news about the long queues of individuals who are waiting outside food banks to just get groceries for their family. So I think this is a very, very scary situation. One of the other things also is that in an effort to push the economy, we have lost a lot of self reliance. Um, of course, we are very naturally gifted. So, luckily, most of the food that we need is still produced in the United States. It's not imported from other places. But for almost anything else, including pharmaceuticals, we are dependent on other economies because they can produce it much more cheaply than we can do. I think this is also a time to maybe start building some internal capacities as well, to maintain society and economies when situations like this crop up. And we are unable to depend on the global commercial supply to meet our daily needs. So
Absolutely.
I think this is obviously, it has exposed a lot of gaps in our system. Society definitely has been impacted. I think in more ways than one, and many of the impacts, as you correctly say, will filter down for generations, not just in the next few months or years even.
Yes.
You're absolutely right about the body sort of DNA makeup being altered because of issues pertaining to this virus. I just think all around, this has opened up a lot of avenues for us to make better decisions about public policy and public health.
Very true. No, I agree with what you just said. And the vaccines. There are many entrepreneurs, innovators, scientists who are working on developing vaccines. But this is a very complex, unique virus because it impacts the human immune system, and it makes it go operational, completely out of control. So a lot of damage that we are seeing in human lungs is, it created by our own body. It's not by the virus. So it's very unique, and by the time we come to understand any microbe that causes a pandemic, and study it, and come up with the proper effective way to create a vaccine, it takes almost a year. You are right about it. It's not something that can be done in a week. So we need to come up with better ways to manage, and not just this pandemic, but also any other pandemic that may be coming our way, epidemic, pandemic that could be coming our way, because we need to make sure that what we are doing as a country, of course, we need self-sufficiency in all our systems, at least critical systems, but that if we see any microbe that is not known entering into our country through air or any other means, then we need to get that information in a timely manner, so we can figure out new other ways to probably prevent the spread of the disease. So there are a lot of things we need to do, and hopefully with the advances in science and technology, especially artificial intelligence and internet of things,
Mhm.
biosensor technology, will be able to develop futuristic system that can prevent these kind of scenarios. But as we see this COVID-19 impacting, and like you said, yes, domestic violence has increased. At the same time, we are also seeing the huge increase in loneliness. And
Mhm.
as we in our risk report that we publish every year, this year's risk report, loneliness is one of the top 10 risk facing humanity,
Mhm.
because with increasing loneliness, there is all interconnected risk that increases, and actually it plays a major role in human health and disease. So from what we know by now about this pandemic, who is hit the hardest? We know that loneliness and domestic violence and all those are increasing, but which who is being hit the hardest, from your assessment at this point?
So I think this is very good. I think obviously, given the nature of this virus, it's hugely impacting individuals who are immunocompromised, as well as groups like the elderly, for example, who are at highest risk of physical debilitation because of the virus. I think those would be sort of the groups that, if you were to sort of look at the people across a section of people who have been tested positive and who um, uh, sort of dying because of the virus, you will see a disproportionate case of patients who are racial ethnic minorities, for example, or patients in lower socioeconomic groups who are more likely to be impacted by the virus. And that is because they do not have those type of luxuries that are sort of needed to be able to socially self-isolate or to be able to they are in jobs that require them to still continue to work in spite of these adverse conditions. So it is very clear that individuals who are racial ethnic minorities, who are socioeconomically disadvantaged, are going to be impacted the most. And this sort of gets back to the whole issue about investments in public health. To invest in public health, one needs to understand the concept of social welfare. It cannot always be about I make money, so or I don't need to sort of invest into sort of a better social system around me. I think i think most of the countries which have been surveyed, where the crime rate is low and people are happy, are the countries where there's a lot of investments in social welfare, whether it's Japan or whether it's Switzerland. These countries have really invested a lot of money into social welfare. Yes, the taxation structure is higher, um, and a lot of money from people who are rich is sort of taken away and put into sort of welfare systems that predominantly benefit individuals of lower socioeconomic status. So I think this is how we sort of need to view public health. Public health has always been a stepchild for our policymakers because it is not seen as an immediate investment. Unlike, say, like a sexy new technology or something like that, which will sell X amount of units and rake so many revenues, investments in public health and public health systems and infrastructures require a lot of costs up front. But people need to realize that they will pay for themselves down the road. So by having healthier people and healthier societies, these investments that we make into building and strengthening these systems of surveillance as well as um, community health will pay for itself several times over. And this has been shown by an epidemic like this, whereby it doesn't matter how rich or poor you are. If you lived in New York City and were exposed to the air over there, I mean, you got the virus no matter what happened. So for example, I know of a friend of mine who's a millionaire and who has been in and out of 3 hospitals already with the COVID-19. So this is not this virus does not distinguish between people who are rich or who are poor. So it's time for us to begin to think as a society about investing into things that don't necessarily immediately translate into profits for us, but will go into making this earth a better place. Now, you asked me, why do we see a sudden increase in all this? I mean, it's because we have changed as human beings. We have changed the ecosystem so much to the point that the ecosystem can no longer handle the abuses that we have heaped on it, whether it is environmental pollution or contamination or modifications that we have done in our quest to make a more profit. We have depleted the sources, the balance in the environment that is needed. And so right now we are living in a dangerously imbalanced ecosystem, which is totally incapable of self-adjusting to a viral pandemic such as this.
Sure, no, I understand your point. But when we talk about investment in public health systems and developing social welfare systems, what is your vision of that? How should it look like? Because we are investing a lot of money in healthcare, insurance, and we are putting in depending on the insurance system to take care of many of the problems. But obviously, it is not the right way to go. So, what should those social welfare system look like? What should the public, investment in the public health look like?
I think maybe we can just start with universal healthcare insurance coverage for all Americans, just as an example. At least kind of have basic preventative medical services available to all Americans. we are the only kind of developed nation in the world which does not have at least a basic universal healthcare insurance for all individuals. So we still have about 15% of our population which has no healthcare insurance coverage at all. Also, we don't have any type of price control on healthcare technologies. So it sort of gives people the leeway to price medicines and other sort of essential drugs at any levels they want, and that sort of puts healthcare out of reach for a lot of individuals in this country. For many families in this country, the only way of getting access to healthcare is by ending up in the emergency department, and then they are at the mercy of whether or not they can the hospital can accept them as a charitable case or not. So I mean, I think we still have some ways to go. I think one of the things like the Affordable Care Act, which President Obama put together, was definitely a positive step in that direction. But what we are saying over the last 3 or 4 years is that a lot of those positive changes that were made are being reversed. And and I know this because I work in areas um, which are socioeconomically deprived, and reversing a lot of the requirements of the Affordable Care Act, like requiring insurers to be in areas of high patient risk, um, has been reversed. And many of the insurers have pulled out of areas like Appalachia, where they know that they are not going to make a profit by providing healthcare services. So I think we really have some ways to go in terms of beginning to recognize that there needs to be certain investments made. Like, for example, there was a pandemic task force that was set up by President Obama, which was disbanded, and which could have potentially formulated policy much more quickly. Estimates are coming out now that we could have saved 30 to 35,000 lives in the United States had we sort of immediately started the physical distancing and not waiting till there were many cases before many of those policies were put in effect. So I think we need to have better systems in place. Maybe our investments are not going the right way, are not being used appropriately. But as you correctly pointed out, we have health information technology at our fingertips, and health information technology overall is very cost effective. And I think it still remains, its potential is vast, and it remains untapped quite a bit. I think we can easily put together better risk prediction models and have those sort of ready to go whenever we are faced with emergencies like this, to immediately shape policies. And that's what I do, is we need data. We need real world data to shape our health policy, not politics. And
Absolutely.
unfortunately, that is what is happening today, is it's politics and not real data that is shaping healthcare policy. And that is not the way it should be.
Sure. No, I agree with you that we do need real data as the foundation of any and all policies that we define and design. So to have effective systems. And if we talk about the insurance, yes, of course, everybody should, have right to their insurance, that they should be able to purchase the insurance. But at the same time, what should a health insurance look like? Because if we look at the system right now, that anyone who has access to the insurance, they go and they get treatment for whatever problems they are facing.
Yeah.
But should we are not seeing human accountability into any of those systems. When the insurance industry started, for example, if you wanted insurance on your home, they would come and check whether you have
Yeah.
chimney, whether you have this or that.
Right.
Now, if you look at the health insurance, most of the time it's the employers that they provide health insurance, so
Right.
everybody is eligible for that. Otherwise, everybody can sign on that. Yes, your premium, if you are signing independently, your premium may be higher if you have
Right.
certain pre-existing
Right.
conditions. but at the same time there is absolutely no human accountability. Now
Yeah,
it is our own, responsibility to keep us healthy. It
yeah,
is
that is true.
responsibility to make sure that we eat healthy food, and that we don't eat junk food, that we take care of our stress levels, that we exercise regularly. All those variables that play a role in keeping us healthy, none of them are playing any role in our insurance, how we get our health insurance.
Yeah, unfortunately, we're not. I think this is a good point that you make. I think, what is sort of needed here is a basic healthcare insurance system, um, that will provide a basic level of services to sort of keep us healthy. Anything above and beyond that should be, and this is what most of the other countries in the European Union, Australia, and Canada have done. Is they provide a basic level of health insurance to keep you healthy. Anything above and beyond that is your call. So again, but at least it sort of ensures that people who are at the worst possible risk of developing health outcomes are getting some type of basic access to health care and are not being left out. I completely agree with your point about we've not built enough accountability into our systems. But many of the private health insurance systems, for example, have developed various strategies to do what they call as managed care, managed healthcare insurance, whereby they promote more preventive health, and thereby decrease sort of healthcare that will potentially be very expensive and also be very debilitating for the patient by encouraging patients to lead a healthier lifestyle. Um, Unfortunately, um, this is something which is inherent in our system. I don't think we sort of incentivize individuals enough to lead healthy lifestyles. For example, it's so much more expensive in this country to shop for healthier foods than it is to just pop in and eat fast food. And so with many families struggling to put food on the table, it's easier to buy junk food and satisfy your hungry kids than to go to Whole Foods and buy like organic food to feed your family. So again, I think we can do more to incentivize healthier diets and lifestyles, encourage exercise right from school itself. So there's a lot of things we can do to promote sort of healthier sort of ecosystems that I'm not saying they're not being done. They're not just being implemented uniformly. And what you find often are pockets. There are areas where all this is happening, and areas like rural areas with high rates of individuals who are racial minorities or poor communities, which are not getting that level of investment into this into these healthy behavioral programs. So I think there's a long way we can go to try to make sort of healthy a uniform thing for all Americans.
Absolutely. No, I hear your point. I mean, there are many interconnected variables that
Yeah.
we need to focus on. It's not as simple as we think, and especially if we are looking at uh, providing basic healthcare everyone to everybody, irrespective of whether they can afford it or not. The current system probably will be not able to manage that, but as we move towards the developing systems based on AI, it should be very affordable, and it should be very easy for each and every country to provide that basic healthcare to all their citizens at no cost. Because once you set up those AI doctors and you set up that system, it should not be that difficult. But it's still a long way to go. And your point of incentivizing good behavior, good accountability in how what steps everyone needs to take, that is also definitely going to play a role. Because yes, we can have a global surveillance system of, you can develop what everyone eats or what they are doing every single day. We can define and design those surveillance system. But at the same time, we have to ask ourselves that, are those surveillance systems worth losing our autonomy, basic fundamental autonomy? Because if someone asks me, I want to have the freedom in choosing what I eat, what I want to eat, what I
Sure.
want to do with my life, what I want to what path of medical treatment I want,
Right.
treating disease, or how I want to stay healthy. That should be my individual right. But at the same time, we want to come up with an effective system, especially now because we are opening up the economy, and the
Right.
governments across most countries have decided that they are going to open up the economy even when the cases have not gone down, because of the their concerns about the economy and the breaking of supply chains, which would create much more severe damage. So the governments have decided to open up the economy, which we can understand. But as we begin opening up our economy, what should be in place for rebalancing the societal needs, for making sure that we don't end up in such a situation that we have explosive number of cases which our healthcare system may not be able to manage at this point.
No, I think you raise a very good point. I think it is very clear. I think what we need to impact, and every day you turn on the news and you see all these individuals who are just frolicking in pools and beaches right now. There's no social distancing at all in place. Ultimately, what this kind of shows is that we are not impacting on people the true nature, how risky behaviors like this not only puts themselves at risk. And so that's fine. If you don't want to, if you want to live your life your way, that's fine. But you are also compromising someone else's life for the worse. And I think this by your behaviors. And I think this is where I think we sort of need to sort of uh, implement in our educational systems, and in our public health efforts, the need to for community and for social responsibility. I think which is somewhat lacking right now. It cannot all be about the individual. At some point in time, even if you are totally capable of making decisions yourself, and you are intelligent, and you don't have any mental health impediments that will prevent you from making appropriate rational decisions, you still have to think about society. You still have to think about the actions your behaviors in public will have on society, and its health. And I think that's where we sort of need to do more work, quite seriously.
No, absolutely. Not everyone is able to make the right decisions with the
Hmm.
information that they have available. So you are absolutely right that not everyone is informed, not everyone is educated, not everyone is capable of making the right decisions for themselves or the people
Hmm.
in their families or in their surroundings. So yes, there is a place for the public health systems. There is a place for government. There is a place for all these different systems that we need to design to make sure that the society operates and functions effectively. So where would you like to see changes if we talk about our country, United States?
I really think we really need more investments in public health, quite frankly. I mean, one of the things, for example, it was sort of what we actually saw is in this epidemic is that many of even the larger hospitals were not. There were not enough gowns, not enough masks available. Of course, there were not enough testing kits available. So clearly, it showed that we have not made any effort into equipping our healthcare systems with sort of some of the basic things they need to be able to do surveillance and control. I think maybe that's a good place to start, is to sort of make sure all our hospitals are fully equipped with protective safety gear and are equipped with sort of and testing supplies can be shipped quickly to these hospitals. They are produced internally. We don't have to depend on another country to have those testing kits kind of shipped to us so that we can send it to our hospitals. I think we sort of really need, and this is my point about developing at least some self-reliance with regards to public health. And as I said, the investments in public health have been much lower than you think because people only see it as an expense. They don't see any immediate sort of gains associated with it. And they say, well, it will require some type of a large epidemic to happen before these are used. Well, you have it right here, right now. When you kind of had that attitude and said that you didn't want to equip yourself, you are right now in that situation where you don't know what to do when you're faced with that epidemic. So it's always better to be safe than sorry. And that's what public health is all about. And I am hoping that this truly increases the investments of agencies like the National Institutes of Health into public health, because right now we see a lot of monies which are being invested into healthcare technologies, but there's not much money being invested into sort of improving social systems of health. Sometimes just investments in social systems of health are enough to prevent the need for these expensive healthcare technologies that are needed when we are dealing with the impact of some of the imbalances that we have created in the larger ecosystem.
No, absolutely. I think nation preparedness is a topic that needs to be discussed very seriously, because as we have seen that no country was prepared. And we did not, there are a lot of different views coming up that we did not get time to prepare ourselves.
No,
Because
but some other countries like South Korea and Japan, they were able to control the epidemic very fast. I mean, yes, they did have a few cases, but they immediately acted and they were able to get the epidemic under control. We were not able to do that.
Yes, and that is a topic of discussion that we need to discuss that. That
Right.
Where did we fail? Where were the gaps? And what we can do so we can make our systems resilient. We can make our country resilient to any and all of these kind of risks that comes our way. Because if this pandemic happened today, then it's possible that many more pandemics could be coming our way. Because if the ecosystem is in imbalance, then it's not just this virus, many other viruses, many other bacteria, many other microorganisms could come our way. So we do need to make sure that we have effective way of getting real-time alerts. We do need to make sure that our countries are self-sustainable, and our basic needs for healthcare, for food, and all the different things that we need for our survival, that we are self-sufficient. We develop that, and we grow that, and we produce that right here in our country, and so that we don't have to depend on other countries, especially in a time like this. So yes, there are a lot of serious questions that are emerging because of this pandemic and our pandemic preparedness, and how challenging it was, and it still is, to manage this pandemic. So there is a lot of serious discussion that needs to happen, and we need to come up together, collectively. We have to come together to answer
Right.
all questions, so we can make our country more resilient. Because at the end of the day, if we are not able to prevent such serious pandemics, then at the future of the very future of humanity is at risk. So nothing should be off the table. We need to discuss any and all
Right.
variables that comes our way. So having said that, what would you like to tell those young brilliant minds that are out there, medical professionals, innovators, technology professionals, who wants to play a role in not only managing this pandemic, but creating new ideas, coming up with new ideas, innovations, and developing technologies and systems to prevent any future pandemic? What would you like to tell those young brilliant minds?
No, I think the message I'd like to say is that it's really, really important that you be able to communicate about what all these exciting new technologies in a simple way that can even get your layperson to accept it, to understand its value. So while we spend a lot of time in high tech labs with high tech things doing things, all those technologies won't be useful until, like you correctly pointed out, there are people don't see the value in it, don't see the importance of it, don't feel the need for it. So I think ultimately at the end of the day, we want to sort of make sure that whatever we are doing in our life is not only improving lives for people, just ourselves, but also the community around us. So to have a sort of a sense of communal good, and to sort of be able to talk about everything and anything you do with people across all cross sections of society, I think is a great skill to have. And for this, you don't have to be a great public speaker, or you don't have to have any special training, but just have an open mind and reach out, and make friends with everyone, and tell them what you're doing and get them excited in what you do. So I think building that sense of community and building that sense of humankind is more important, especially in times like this.
Absolutely. That developing that feeling of community, or that community around you, irrespective of whether it's at your family level, or your village level, or town level, or a global level, the developing community is the most important thing that we can do it today and for the coming tomorrow. So thank you so much, Professor Balakrishnan,
Thank you so much. Thank you.
for participating in this roundup today. We appreciate your thoughtful insight on health and social impact of COVID-19, and our global viewers and listeners will benefit tremendously from the information you have provided today. As a result, this risk roundup dialogue has been of service, and we thank you for that. So Risk Group is a strategic security risk research platform and community. Our ecosystem is the first and only cross-disciplinary and collective community that is made of top scientists, security professionals, thought leaders, entrepreneurs, philanthropists, policymakers, and academic institutions from across nations, collaborating to research, review, rate, and report strategic security risks to protect the future of humanity. Add your voice to risk groups, get involved to protect the future of humanity. Until next time, I'm Jayshree, host of Risk Roundup, signing off. See you next time. Thank you.